All right. So I think we're live on Facebook. I'll give the old cue that this is where our take will be for our raw footage. And I'm just going to go with introductions. Are you ready?
Yeah, I'm set.
Awesome, man. So I'll just give a quick little pause here. All right. Hey, I'm Dr. Jason Bradley, founder of Epic Functional Medicine and the developer of the Epic 5 plan. And today is Wednesday, December 30th, 2020, our last show of the year. And actually the very first show of what is now branded as Guerrilla Health Radio. I'm so excited about it. And my very first guest on Guerrilla Health Radio is Dr. Daniel Chong. I'm so excited to have Dr. Chong on the show. He is a naturopathic physician that specializes in cardiovascular disease. And he's also a wellness expert, an aging expert, and also has tickled my fancy with his data hounding on COVID. Dr. Chong, welcome to the show.
Hey there. Nice to see you.
Yeah,
Thanks for having me. Thanks for having me.
You bet. Thanks for being on.
Yeah.
You know, I just want to jump right in, and we'll come back to your story here in a minute. And I'll certainly be asking you about this, but here we are. Dr. Chong, do we have to be concerned about COVID?
Absolutely. It's I don't know if anybody's noticed out there, but it's certainly made an impact on our world. So when I hear you say that, I think broadly. I think one of the issues all along here has been sort of like the lack of interest, willingness, or ability to be sort of like to think from a nuanced perspective and versus just a black or white issue, right? So if you say, do we have to be concerned about COVID? If we're only looking at it from the very, black or white issue, it's like the virus. But in my opinion, when you ask that, I instantly think of all the different things that impact, that have been impacted by what's going on with SARS-CoV-2. And so I think it's, possibly the biggest thing to hit modern human history. So yeah, absolutely, we should be concerned, but probably more than just the health related issues. Yeah,
I agree, and we'll come back to that here in a minute. And I just came out with a little gotcha journalism, and certainly in journalism, I mean, as we know, everything we try to make it black and white, good and bad. Pluses, minuses, ones and zeros, right? I mean, that's the way we like to create that dichotomous, argumentative approach. But no, I think that you nailed it. We're going to come back to some of those more nuanced issues. And in fact, I want to give you a chance to chat about yourself just a little bit and tell us your story about how you got into doing what you do. You're an expert in so many areas and have helped so many people. But I wanted to let you know, I don't think that you know this, that I don't remember if it was the very first post that I saw by you. And actually, I don't think it was a post. I think it was a comment that you made. And it was really about, and it wasn't even about COVID. I think it was one of those comments about, hey, we spend all this money on the military, and yet we have people going hungry and are homeless here in America. And I think the compassion that came through, I think just in a real basic, post really led me to you. I've been following you ever since that post. And like I said, I mean, you have a knack for hitting the data in a way that I think is unique and interesting. But before we get to that data, sir, tell us a little bit about, your background, how you got to doing what you do, how you got to helping so many lives.
Yeah. This is my 21st year in practice as a naturopath. And I'm the son of a doctor, surgeon. And I was the child who always wanted to be the doctor and follow in my dad's footsteps and become a surgeon and all of these things. And kind of maintained that until I got to college, pre-med, et cetera. And then some types of lights started going on for me. I always, in retrospect, know that I kind of just didn't feel comfortable with some aspects of conventional medicine but didn't really realize it till I really started thinking directly about it. And within my first year of college, I was like, I don't really want to do that. I do want to help people, with their health, but not through that way. And so I didn't know anything else. I didn't know what naturopathic medicine was. I didn't know what chiropractic was. I didn't know what acupuncture was. And I think you're a chiropractor, is that right? Or that's your background?
Yeah, I have. It's one of my backgrounds. Yeah.
So one of your main back. So you'll like the story because this is back pre-internet, believe it or not. And so what I did was I just started exploring things, and I sent away. One of the things I did was I I got information from Western States Chiropractic. Again, it just, I didn't know anything about it. Just thought it sounded cool. So long story short, they had a video, VHS tape. I was watching this video and it's talking all about chiropractic. And at the end, they showed this doctor giving a patient an adjustment, and they gave him a cervical adjustment. And like, I had never seen anything like that before. And it looked like the closest thing was like, Rambo snapping somebody's neck on the movies I had seen. And I was like, I'm not doing that, so eventually I discovered naturopathic medicine. And as soon as I read about it, I was like, that's what I'm supposed to do. And so went straight into that and been doing that ever since.
I love it. I love it. And it's interesting. I think I've told you this before, that I think that we're cousins on some level. I'm not sure how, because I've been in practice for 21 years. My dad was not a surgeon, but I grew up across the street from a surgeon, and that family was very close to my family. And certainly, I just like to say this guy's name, and I think you'll appreciate it because it sounds like an old Western TV show doctor. It was Dr. Jack Morgan, MD, right? He was replaced by Dr. Jim Buck, MD. And I'm like, really? Like it's like we're in Western Colorado, but
right.
Nonetheless, these folks influenced me as well. And I had never heard of naturopathy or chiropractic or acupuncture either, and always wanted to be a doctor. And literally, you just peppered my own story with yours. I mean, it's fantastic. And I can tell with your passion that you've always, like you said, you've always been passionate about being a doctor, helping others. And the way that you, again, present information is definitely from that Latin root of doctor, which is, docere, or one who teaches. And I certainly see you as someone that's at least attempting to educate. I also see some of the wonderful comments that you and I both get, but where people get awfully mad about the data that you present sometimes. Tell us, tell us a little bit about that. Do you have a story of someone getting upset with some of the data points that you share?
Sure. And before that, I just want to commend you, because one of the things I noticed about you early on was you're almost like, I don't think I've seen anybody out there quite as good as you are about bringing up controversial topics on your posts without any, I don't know, you have this way of just bringing stuff up and just like, hey, what do you guys think about this? And it's so non-threatening and you're not stuck in any, particular mindset or opinion, or at least that's how it comes across. I'm sure you have your opinions, but
right.
You do a great job there.
I appreciate
so I've
that.
learned from you. I'm trying to learn from you on how to be a little bit,
hey,
more
neutral. I'll give credit where credit is due too. So I have a good friend of mine, and I mentioned him quite a bit, but mentor, colleague, coach, armchair psychologist, my friend Alex Sharpen, CHARFEN. And I highly recommend, if you're not following him, everybody should be following him. Listen to his Momentum podcast. This man is brilliant. But what he taught me a number of years ago, and again, it was one of those abrupt learning pieces, right? He said, questioning and curiosity over confrontation. And
Nice.
I think that's a good approach to having a discussion. It doesn't always, as you know, I'm going to turn it right to you, even with the best efforts of just being open and curious and like asking those questions, why do you think that? What do you guys think about that? It still pokes the bear, right? So tell me a little bit about you poking the bear and getting poked back.
Well, I will say, rather than a specific instance, the thing that I've learned especially over the last 7-8 months, 9 months, how long has it been? 10 months now, is that oftentimes what I've realized is that people that appreciate what you're doing don't tend to chime in as often. And so I got to a point, I don't know I can't remember if you noticed this or not, where I was feeling pretty exhausted with just, it's not so much defending myself, but just, I have this silly sort of need to try to satisfy everybody's curiosity, everybody's questions and whatever, and wanting to come across as being as thorough and level-headed and data-based and fact-based as I can. And it can get exhausting when you have people just coming in and, well, what about this? Well, you're wrong about this, and blah, and so I haven't had any real, too many, what I'd call confrontational debates or whatever with people. But I did get to the point where I was feeling quite exhausted, and I made this post one morning. I was just like, I'm done. I can't do this anymore.
I remember that morning.
Yeah, and I, I tried to explain myself as well as I could, and why I was feeling the way I could, and I got this amazing outpouring of the most thoughtful, kind, loving comments from people that I didn't even know were reading my posts at all and saying how helpful they've been or whatever it's been. And it really shocked me a little bit. And so I went over the course of like 2 or 3 days from feeling like I'm done to feeling like I can't stop. Like I have to keep going, because apparently at least a few people out there are appreciating what I'm trying to do, which is, again, one person I remember describing it as a curator, because I always try to make a point of saying, the majority of what I bring up is not my information, and it's just the result of finding good people to follow, smart people to follow, people that are really thorough, but curating it and trying to put it together and synthesizing it into an understandable point, but still not almost ever going down into the weeds and into areas where it's like there's not a lot of certainty about what's being said or whatever, and trying to stay out of there. And so it's been an interesting experience for sure. I'll say that.
I remember that day that you posted that, and I remember thinking like instantly, I wonder how long that's going to last. And in my head, I know you said 2 or 3 days, and it probably was. In my head, it was like 24 hours, and you were back. Like I'm back, and I think
you and my wife noticed that very quickly.
Yeah, I think
who was also like.
Well, and I was going to say, I think it speaks highly to your passion and your purpose, because I will say, we're just gushing on each other. But I will say that, it comes across that you really are just trying to educate, trying to help, as much as possible. I got it.
And I will say the one other thing is it has been like therapy for me, because when I feel like something concerning is going on, or especially anything that could impact my family, my response is to try to find out everything I can about it.
Absolutely.
And in this case, try to find out everything I can to prove that what we're doing is warranted and appropriate. And so I can't help.
Go ahead.
No, I was just going to say I can't help doing it anyways, really, because I knew in my heart I would at least continue looking. I just didn't want to share it as much anymore. But as you know, that went out the window. So here we are.
No, and I think absolutely. And I think that, there's a lot of times, I know with myself, and I'm sure you kind of spoke around this too, where, and I'm going to use some bad words here, but sometimes my ego, my sense of self wants to step in the way of what I think is an important, I don't know if message is the right word, but it's some information to share. And we all know, like, if I put this out there as an example, there's some data out there suggesting that COVID's been in the US, at least possibly since September of 2019. When we start looking at that data, it starts to bring up a lot of other questions about, why all of a sudden did it become a really scary thing, as of March, and why did it take, it just starts to those studies start to bring up other questions that don't quite fit into the narrative. That don't quite fit into I don't like to use the word narrative either, because it sounds like there's an agenda.
Yeah.
I'm not saying there is or isn't, but it doesn't fit into the story that we've all been told, and it starts to ask other questions. So, and I think that you're brilliant in asking those questions. So I know that you've been following data. I've been following you following the data. Other people are following you following the data. What's been the biggest, I don't know if surprise is the right word, but like you said, you're going into it objectively. You're trying to understand it for your family. You're trying to understand it for, your friends, your family, those that you love. And then also just for all of us, are the measures we're taking appropriate? Are they too much, too little? What's been the most surprising bits of data that you want to share?
And then again, just to preface it, my following the data is really just following other people who are really good at following data and gathering. But that being said, I think far and away, really, I just posted about this, I think it was yesterday, what you'd call like the congruency of experience from state to state with the cases and then subsequent deaths or hospitalizations and deaths that occur, and how incredibly congruent they are from region to region in the United States, from different parts of the world. And the essence of the post I made was looking at all the Midwest states, or the majority of them, something in the neighborhood of 40 million plus people. Mm-hmm. And the graph that I posted showed all of the up and down wave of cases as they went through these areas, literally all doing the exact same shape to the exact same peak and coming back down at the same within literally 1 week of each other. And the point of the post was, if the only ways to impact this virus and what it's doing are through human action, whether it's restrictions, lockdowns, whatever it is, then that means that 40 million people all got on the same exact page at the same exact time to the same exact degree. Right. Which to me is impossible. So I speak a lot to the idea of this virus is going to virus. In other words, viruses do what they do, and especially novel viruses or ones that are less familiar to our population. And unfortunately, sometimes when they do what they do, it has horrendous effects, and then other times less so. And there's all these different potential reasons for that. But the thing that's been most surprising to me, or is really the lack of acknowledgement towards that idea in the media, with politicians. I'm in Oregon. We have a governor who seems to be completely unwilling to acknowledge that this is what happens, and she takes credit for anything good that happens, and points fingers and places blame on the public for anything bad that happens.
Wait! All you said was she's a good politician. That's all that I just heard there.
Yeah, it's a perfect example. So, my surprise again is the lack of acknowledgement towards nature and towards what happens when these things happen.
So, and I can jump in a little bit too. So we're here in Iowa, and I really mean this with COVID. We have been the Wild West of COVID, man. We are the Sweden of the United States. We never had a lockdown. We had no enforcements. There were certainly, don't get me wrong, suggestions. And then, of course, there were a number of corporations that are here, larger companies that are here in the state that took a position of, hey, if you're going to shop here, you got to wear a mask. So they took it upon themselves. But there was never an order from the governor for any of that.
Wow.
She basically said people can do what they want. Here's what we suggest. And of course, all the basic stuff: hand washing, social distancing, masking. It was all suggested, just not mandated. Wow. Except where specifically in a couple of counties, and then those were left up to not even the county board, but more to the mayors of the main cities in those counties. We actually happen to live in Johnson County, which did have a mandate for all of that as set forth by our local leaders. But again, the governor just said, do what thou wilt. And what's interesting is from the Wild West, a while back, post COVID, but at the same time, not super recently. I think it was maybe June or July, right when people were starting to maybe be mobile a little bit more. We actually, I was wrong. It's in July. I remember now, it was in July. We had a need to go up to Minnesota for some business. And so my wife and I went up there. And as soon as we crossed that state line, it felt like we went from the Wild West to way back in early March, when we were first getting wind of this and everybody was scared. And I'm not saying they should or shouldn't be, but it was a palpable difference between the two states. And this was many months later.
Come on over to Oregon. See how that feels.
Yeah, I can't. I would like to. I'm going to take you up on your offer and visit you.
Yeah.
But then when we came back to Iowa, because we spent, I don't know, about a week and a half, it seemed like, in Minnesota, came back to Iowa, and we were just filling up our car. after we crossed the border. And I swear to you, this is what it felt like. And I mean, I can't explain it any other way. Then we went from that, I'm going to call it the deer in headlights feeling in Minnesota, cross the border, first gas station that you could pull into. And I swear there were people with their shirts off, high-fiving each other, doing like chest bumps and in the gas station parking lot. And I mean, it was, I don't think that was really what was happening, but that's what it felt like when I came back to Iowa. And it's been that way ever since. I mean, like I said, from the beginning till now. And I said that our governor, Kim Reynolds, was either going to, seal her political death here, or be the person that people can say, wow, she made the right decision. And I mean, from what I'm hearing from you, if I'm understanding this correctly, just to kind of regurgitate that, it seems like we could compare Minnesota, Illinois, two states with high restrictions, right, to Iowa with no restrictions. And Absolutely. That bump was exactly the same. Am I correct in that?
Absolutely. And add a bunch more: Wisconsin, South Dakota, North Dakota. They all, again, some had higher amounts of cases. Obviously, there's difference in populations, density, and that type of thing. But the key is the curve, which shows really the behavior of the virus as it's moving through the population, and they all are identical. And literally within a week, and the only thing that could possibly explain that is the season. And I do remember also seeing a different study that plotted, see if I remember this. It was a graph that plotted, it was between, I believe it was between July or August and November. And it plotted drops in temperature over that time. And then what states had the largest drops in temperature from, again, July/August to November. And it showed like a clear, like direct relationship. The more your temperature dropped during that time, the more cases you got, like period. And it just goes right along with that same thing. So,
and it's interesting because, like you said, viruses do what viruses do. And I think like I said, I think that you and I became acquainted somewhere through COVID, which has been, like I said, great getting to know you. I like that you said there's been a lack of acknowledgement by the government. I want to come back to that. And we like to the government, of course, likes to take praise for things going well and point fingers when things aren't going well. It's, like I said, good politics, so to speak. It's also the worst of politics, right? Here's my question. How do you think the media is handling that acknowledgement? I mean, like you said, I mean, you're not making up the data. It's just plot points on a graph. It's literally just objective numbers. How do you feel like the media has handled this? Has there been an acknowledgement from the media?
I would say they've handled it by not saying anything about it.
Yeah.
Essentially, they, what I've seen, and again, I will admit that I, at this point, don't really pay much attention to mainstream media anymore because it's not very useful. But the things I've seen, what I've seen over time is you always have on the side of the screen, started out with case numbers, then it went to deaths, and then it went to hospitalizations. But it's always a total. It's never giving nuanced understanding of the rest of the picture. What's the infection rate? How anything else. It's just these total numbers that are just mounting. Of course, they're going to mount over time. So there's little recognition of, again, that word always pops up into my head now. Nuanced look at the data and what's actually happening, and especially, I think the least amount of attention has been given to how, they talk about the United States and the number of cases in the United States and the number of deaths or whatever. And like, this is a massive country, right? It's like there's completely different regions that are going through this very differently. They never point out the fact that even though, last April, New York City was getting hammered with, and had, as I'm sure you and everybody else knows, massive amounts of deaths. There's some potential explanations for some of those, but now there's like almost none.
Right.
And there's just little recognition to how it's shifting and changing. And the only thing I can ever see it helps explain that is the way that a virus moves through regions relative to the seasons. I mean, And the other thing I just want to point out, when I say stuff like this, it doesn't mean I'm just sort of saying, so stop caring at all,
Sure.
or there's nothing we can do. The thing that drives me crazy is that there's such little attention and effort, and information given towards the idea of, well, what do we do as our own, in our own lives to help be resilient and do the best we can in the face of a potentially inevitable exposure. And I say potentially because obviously not every person is going to get exposed, but it seems to just be moving on through. And if anybody wants to look at it, it's very interesting. You can see it. It hasn't just come into our entire country all the same uniform way and moving out of it. It's gone through regions, done the same thing, all these different regions. And so it's kind of inevitable to some degree that it's going to go through places. So it would be smart to me to like be ready. And there's no be ready. There's hide, there's disinfect, and there's wait for the vaccine. That's all we ever hear.
It really is all we ever hear. And speaking of numbers, and I'm just going to throw some numbers out here. I asked you earlier in a message as we were going back and forth with each other over some things semi-related, but not necessarily directly related to chatting today. I was trying to look at the difference in the IFR, or in infection fatality rate, death rate of COVID versus a seasonal flu. And you would think this would be a really easy number to come across. Oh, specifically in an aged population of 65 years or older, right? And you'd think that this would be just readily available. And it's not super readily available even from the CDC, but I can share some numbers from the CDC. Yeah. If we go back a couple of years, we had kind of a wicked flu that went around back in 2017-18 season. We had about 6 million flu cases. Then it drops to about 3.1 million the following year, and then less than 2 million in the last flu season. We're moving into the 2021 flu season right now. So the flu rate, was coming down. I want to be really, clear about that. But when you start looking at new flu cases, when you start looking at, boy, I'm going to get myself in trouble here. COVID deaths, I'm just going to, in that elderly population, 65 years or older, it's interesting. And the CDC is a little bit behind on the real-time data, right? Because it gets posted about a week later. But, let's just go with that. The stats they're posting are fairly legitimate, or at least as legitimate as any type of data can be. The total deaths in this age group, 65 years and older, from COVID, total, all of them, was about 230, I'm going to round it up, about 235,000 deaths. And it's a big number. Out of that number, though, the CDC says about 222 million, a large chunk of that, additionally had the diagnosis of pneumonia. And about 4,500, roughly, about 4,500 additionally had a flu diagnosis, which actually, if you go way back in that age group, again, we dropped from 1.9 million cases in the 19 to 20, but we had I'm sorry, deaths of about 14,000, 4,500 from the flu, basically from the end of 2019. But the point that I'm saying is, if you subtract the total deaths of COVID minus those that had pneumonia also, minus those that also had the flu, we wind up with about 9,000 deaths that seem to be solely related to COVID. Right. I'm fudging that data a little bit. I'm not trying to. I'm just trying to keep it really simple. There's a lot of nuances in there again.
Sure.
How does that data make you feel, or do you have any comments on that?
Not surprised. I mean, it's to go back to the beginning of what you said. For starters, it is very difficult to find this type of information at all. You have to do some serious digging. So one of the things I've harped on to some degree is, what would things be like if there was pure transparency from the beginning? And telling us everything that's going on rather than just pieces that you can't really argue all seem to be geared towards things looking as bad as possible. I don't go into the why reason. I don't like to get into the what's the agenda type of thing, because I don't know that there is an agenda. I think it's complicated, and there's a lot of potential explanations, but that's clear that the information that the average person in the public gets is not the whole picture. And to find the whole picture, you got to dig, and then sometimes it disappears, and then all kinds of different things like that, or sometimes it changes from one year to the next in terms of what they're looking at and whatever. So it's so hard. And then when you look at what you were just talking about, it's a really interesting experience to try to understand the reason behind the categorization of deaths and how they're being calculated and quantified and whatever, because you can't, I would say, long story short, you can't, when you do that, you can't come away feeling like there's a bit of an effort towards making everything, as many deaths as possible, some related to COVID. I don't know why, but it seems like that just happens over and over again. Whereas when you really define it out like you just did, it's a relatively small number. And then, of course, the people out there who are coming from fear and whatever are going to say, oh, so what? You don't think COVID's causing any problems? And I'm like, of course not. It clearly is. Unless it's just a total...
that was my question.
Right. And so there's no doubt that it's killing people, but it gets really messy when you start to look at pneumonia, especially. And there's I remember seeing a study a long time ago that looked at hospitalized COVID patients and how many of them had co-infections of one type or another. Wow. And it was essentially all of them.
Right.
So, the most practical sort of conventional way of looking at that is that the virus brings the immune system down and makes it vulnerable to other infections, which is very legitimate, likely contributing factor to all these pneumonia cases. But the point that I would then bring up was like, so how is that different from any other year beyond the fact that it's a little worse this year?
Right.
And the fact that we've had this full-on massive magnifying glass on the entire process like never before, and every death that happens, and this death and that death. And if we put a magnifying glass on cancer every year, people would come away probably eating better because they would be so freaked out by these people's experiences and everything. And we don't do that. So that's been the interesting thing to me, is that magnifying glass. But when you really look at it, it's so complicated.
Well, and even using the worst case scenarios, again, I want to be on record saying every death is still a death,
Absolutely.
And there is loss and sorrow and grieving. And I don't want to poo-poo, 9,000 deaths or 290,000 deaths. Or 9 deaths. I'm a big believer, and I think that you are too, with, your work in cardiology, that we can prevent so much. Even the American Cardiology or American Heart Association says on their own website that 80% of heart diseases, deaths due to heart disease, could be prevented in the United States. That's about 800,000 people a year. In their journal Circulation, they say that 90% could be prevented. And again, but we don't really hear about that piece of the puzzle. We hear about the deaths due to heart disease and heart attack, and that we need to, here's the way we're going to treat it, right? Or prevent it, which I'm going to try not to go down that road, but it really is pharmaceutically based in this country. We are 5% of the world population, and we consume to 85% of the world's pharmaceuticals. And if better health through pharmacy was the reality, we would be the healthiest country on the planet. And yet we are notoriously the least healthy, I don't like this word, westernized, industrialized, modernized, whatever that is, country on the planet. We really are. We win the prize for the worst healthcare and the worst health. 75% of us are obese, are overweight, 40% obese, about 35% overweight. I know you know these stats. And I think that you nailed it when you said, hey, if we start to look at these risk factors, the virus probably does weaken the immune system. And then there are probably opportunistic infections, opportunistic, other risk factors that probably take the patient out. I'm not trying to say no one dies from COVID, but it's probably complications related to COVID more so than anything else.
Very likely.
And like you said, because a virus is going to do what a virus does. A virus is going to virus. I mean, I think that you said it brilliantly, and I think that's a great quote. So,
and also just to mention, there are clearly some people out there who did not, while I totally agree, the likely reason why the United States looks to be getting more hammered than many other parts of the world by this has to be due, at least when we're talking about deaths, has to be due in large part to our health, or lack thereof, that's so clearly present in our population. It's just horrendous. So that has to be part of it. But then it's also important, to note that there are clearly some people who were otherwise apparently healthy and either got really sick from this or died. And so there are some other factors going on that I think are less understood and less well recognized. And there could be genetic factors involved that make some people more susceptible than others, and other aspects of their health that are not so much in their control. So it's not I just don't want to sound like, oh, this is all, we could just prevent all of this by just being healthier. My whole point is we could absolutely work on some of it if we got any type of both messaging, education from the powers that be, but also opportunity for people who don't have that. That's another thing I've been harping on is, there's people out there who the only choices they have in their lives because of how they're set up are unhealthy choices.
Right.
And then the other thing I'll say is, like, early on, it's probably 2-3 months into this, hearing the ad nauseum messages from, again, politicians, et cetera, about how we're all in this together, do this for the greater good and do that for the greater good. And if you just do this and change your life this way, then we can make it. We're all in this together. It's a team effort, blah, blah, blah. And then literally I see for the first time a commercial from a pizza restaurant that I'm not going to name the name, but they had a brand new pizza where they infused hot dogs into the crust as like their new offering. Like literally, like the commercial after the person on the news saying we're all in this together and just try to be as healthy as you can by doing this and that. And then it's like, except, if it pisses off industry, then we're not going to say anything about it.
Hey, let's not forget that in journalism, right? I mean, and if you haven't heard this term, I'm going to share a great term with you. So in journalism, there's, the news or the stuff that we're talking about. Yeah. And then there's the commercials or the ads, right? And I kid you not, the space between the commercials and ads, whether it's print or video or whatever, is called the news hole. And I love that I know, it's not surprising, is it? It's the news hole. And the reality is, you don't want to bite the hand that feeds you. No pun intended, with hot dogs infused into a crust. I don't watch television, so I don't see commercials. I have to go out of my way to find commercials, right? Yeah. Don't get me wrong. I watch a number of little episodic shows on Netflix, but I don't watch, regular TV. So I'm not exposed to, I'm going to use some bad words here, programming and commercials, right? I'm just not as much. But I think that you hit on with, sorry, go ahead.
No, I'm just agreeing.
Good. I was going to say that you mentioned a couple of things about risk factors. And I think the reason I brought up the American Heart Association again is because, you work in the cardiac sciences and, you work with cardiac health and cardiovascular disease. And you nailed something where we start talking about basic education, available food, available resources. And, sometimes I get accused of being a little ivory tower elitist. Why can't we just all eat, real food? Michael Pollan, eat real food, not too much and mostly vegetables, right?
Absolutely.
And I am, I'm literally called an elitist and kind of maybe some other 4-letter words in there too, for saying things like that, because I'm not taking into account the level of education. I mean, some people think hot dogs are good sources of protein and that the pizza that it's shoved in. I mean, I remember when I went to school, they said that a pizza is almost a perfect meal because it's got carbs, it's got a vegetable, which is the tomato sauce, and it's got, fat and protein from the cheese. And it's like, it's the perfect food. Why don't we all eat that perfect food? And I mean, shoot, throw some hot dogs in there. I mean, I know it's crazy. What do you have anything to comment about risk factors? I mean, because ultimately with COVID, like you said, overwhelmingly in the 90th plus percentiles here, the folks that are dying, there are some that we haven't figured out yet. It's probably genetics and some other risk factors we haven't figured out. But overwhelmingly, the data shows, every expert agrees, the folks that do succumb to COVID, if we're going to say that, have at least one, if not more than one risk factor. What should be done about this? What do we need to be doing?
Yeah, I mean, I think 2.5 or so was the average that I remember seeing early on. 2.5 comorbidities was the average number that people had who were dying of this.
Yeah.
And so, you know, that's a whole hour-long discussion in and of itself. But I think if we're trying to keep it simple, right, and trying to keep it to things that most people can do, and I will say real quick as an aside, I was also, like you, woken up to the idea that I better make sure that I'm acknowledging the people out there who, you know, even if they got all the education they could possibly get, they don't have the opportunity to choose, to make choices that some of us do, to just go to the health food store or whatever. Right. You know, if there's a liquor store on one corner and a, you know, convenience store in the other, and that's all they have in their neighborhood, it does make it harder. So yeah, I've learned more and more to make sure that's part of the discussion. But, you know, so from that perspective, I try to come from there, right? And I almost never mention, you know, a bunch of supplements or whatever that are all expensive and potentially hard to get to come by. And I try to focus more on things that people can just do in their lives. Even, you know, less people with less opportunity. And I think that vitamin D, even though I'm now going right to a supplement, that is one that doesn't fit in that category of like not mentioning expensive supplements, because it's super cheap.
Right.
And, you know, the government has spent, I don't know how many billions of dollars now on just gambling, literally gambling on vaccinations to see if they work. We could throw a little bit towards vitamin D levels and probably do a huge amount of good. I'm not going to try to make a comparison between vitamin D levels and vaccines and the impacts on people, but you cannot. I mean, there are. If anybody wants to know, there's a website. I believe it's a C9, like the letter C19 vitamind.com, where they've compiled all the research that's been done so far on vitamin D and COVID, and it's astounding. You would look at that if you were an alien that came down here from wherever into this situation and came right to that website, you'd be like anticipating whoever's talking on the news to be leading with information about vitamin D. It's totally accessible. It's totally cheap and easy to find, etc. And yet you hear nothing about it almost ever. It takes some obscure little tiny story, you know, in some random little tiny news station. Sometimes you'll see that, but you never see anything on national news. You certainly never see anybody like Fauci or Birx or anybody else like that talking about it. So I think in terms of impact, obviously there's other things: good sleep, exercise, trying to eat, like you said, like Michael Pollan described, all of these things as much as possible. But when we're talking specifically about what this virus is doing and why some people are getting so hammered by it, I haven't seen anything as clear cut as vitamin D levels in people's blood. And then, you know, there's nuance to that as well. But
I just wanted to say, I totally agree with you. And vitamin D, you know, shines as, I'm just going to use the words cheap and readily available. But it's interesting. I mean, I'm sure that you follow international news as well as national news. And it is different, right? I mean, here in America, we're not sharing that. But BBC ran on the 28th of November. It says free vitamin D pills for, it says 2.7, I'm 2.5. It's actually 2.7 million vulnerable in England, right?
Yep.
So here we do have a government stepping up saying vitamin D is essential for prevention, possibly even treatment. I don't like that word there, but right, of COVID, and stepping up to those, you know, people impoverished. folks that are in long care facilities that are older with all these risk factors, and going ahead and just giving them vitamin D. And here in the United States, we've taken no action, and we don't even give it lip service on the news, even for people that might be able to afford I don't even know how much it would be a week, 30 cents, 20 cents a week. I don't even know if it might not even be that much. But it's a very inexpensive, very inexpensive nutrient, readily available, that I'm fully behind our powers that be widely distributing that. Along, if they want to do the vaccine, let's widely distribute the vitamin D as well. I mean, cost factoring that out, I mean, it's not going to change the overall, tab at the end of the day.
It's one of those things that just leaves me with these big, huge question marks. Why are we not doing that? Because, and I can't I end up not being able to help myself, but coming up with, less than nice explanations for that, because it doesn't make sense otherwise. Like, why? The only thing I can think that there's not more, at least equivalent amount of messaging around stuff like vitamin D. And again, don't get me wrong, there's all kinds of other things. I thought we would just focus on that because it's such a straightforward topic. But to me, there's going to be a portion of the population that hears that, if they got that information from the news, it might make them question a little bit whether or not they need to do a vaccine, or whether or not they need to do these other measures, lockdowns, etc. If they had something that's so apparently, effective. And I mean, just as an example, there's a study that I'm sure you've seen this study. I believe it was they looked at people who had the low, like what you'd consider deficient levels of vitamin D, and compared them to people that had sufficient levels of vitamin D. And there was a 4 times lower rate of hospitalization in the people that had just sufficient levels of vitamin D in their blood.
Right.
And when you hesitated a little bit about talking about treatment, there's actually another study out there that they looked at something called calcifediol. It's like an activated vitamin D that is actually a prescription that they gave to people who were in the ICU. Or sorry, they were hospitalized, and then they gave a portion of people calcifediol and a portion not. So it was a pretty well-controlled study. And it was something like more than 50% higher a number of people had to go to the ICU if they didn't get this calcifediol than if they did. So there's these potential, it's a small study, et cetera, but it just shows this humongous potential. And then all you hear is crickets after that, like nothing. There's no, what about this type of information? And then, I just can't come away with it.
Hydroxychloroquine made the news, I'm not listen, I'm not trying to jump on pharma versus, pharma alternatives at all, but it is interesting in this country, which is, one of 2 countries in the world where we do allow direct to consumer advertising for pharmaceuticals. The other being New Zealand, of course, where our dialogue, our narrative, our discussion is really driven around what drugs work and how quickly can we get a drug, a vaccine, right? As opposed to, and again, I don't think it's as simple as giving everybody vitamin D, but it sure might give a lot of people a leg up if they had adequate amounts of vitamin D. Like I think
that's inarguable.
Yeah, and I wanted to come back also to just a couple of stat points real fast, and I know we're getting short on time. I'm not pointing my finger at you, Dr. Chong. I just wanted to bring up a point where we said the United States is getting hit a little bit harder than the rest of the world as far as COVID gets. Our worst case scenario death rate, if we just took all the deaths that we've attributed to COVID, whether or not they're also pneumonia or flu or whatever, just everybody that's COVID positive that died, and the total number of cases that we've accounted for, it is about 1.73% is what that number comes to. I know that sounds like a small number, but when you apply it to a theoretical infectious rate of 100% at 350 million people, it's still a lot of deaths at 1.73% of the population. So I don't want to poo-poo that. However, worldwide, the current numbers are running at 2.18%. So we're actually a little bit lower than the world average, but we are really much higher compared to most, again, I don't like the words, But that's what we're left with, Western industrialized, modernized countries. We are doing, quite a bit worse there. So I have a question for you. You said viruses are going to virus, right? Colorado announced, was it yesterday, that, they have the mutant strain out, right? Are you surprised by this virus mutating and there being a new strain?
Not at all. And again, I don't want to ever talk like I'm anything close to the level of understanding of this as a true expert in virology or whatever. But as I understand it, and what makes the most sense is novel viruses always will mutate. They don't have brains. They're not sitting there trying to figure out what to do. But just by the very nature of them, if the point is to get into human bodies and replicate, in their cells and all that type of thing, it wouldn't make a lot of sense for them to mutate into forms that are less contagious but more virulent in terms of killing people. It would make sense to do the opposite, and so we would fully expect to see mutations, not expect them to be bad. People hear mutation and they instantly think bad. But it could very well be that it's mutating into forms that are more harmonious, so to speak, with the human population, so that they can continue to sort of propagate and do what they do without killing us all off. Because then, what would be the point of that?
Exactly. I mean, if we kill off all the hosts, then
right,
there's no way to spread the virus anymore, right? So it only
and then when that study came, or the news started coming out about this mutation, I think it started in England, and now they're finding it everywhere. I did a little digging, and I found a fascinating graph that showed all the mutations they've noted since the beginning, and there was close to 3,500 different versions already out there. So, but nobody had heard anything about any of them until they came up with one that might be a problem.
Right.
And then since then I've seen some pretty high level experts go, hold on, everybody, like slow down. It's not necessarily a bad thing at all. And it's pretty much fully expected and that type of thing. So,
Well, I think that you nailed it, that, again, I was going to say, I'm not going to pick on the media, but I'll pick on the media all day long. I mean, I think anyway, I won't give my opinion on that. But what we're told, again, in that black and white, is there's a new mutation and it's more contagious. There's not really a nuanced discussion of what does that mean? Is it more deadly? I mean, if we had a more contagious and more deadly, fill in the blank of anything, I mean, that's kind of a bad scenario. But again, we don't know these things yet, and I think there's a lot of hoopla, so to speak, that's presented to us, because it's sensational, because we gotta fill that news hole with
absolutely.
You gotta fill it with sensational journalism so that we keep watching it and we can't take our eyes off it, because God knows we are all palpitating and desperate for some good news, something to come through that news hole that's like, thank God we heard that, thank God it's not as bad as we thought. But it's, we keep getting that carrot dangled in front of us that's like, this is bad. And again, I don't want to poo-poo it. People are dying. Real people, real humans are dying, and any death is a bad death. Certainly any preventable death, which comes back to risk factors. You mentioned that we could have a whole hour on risk factors, and I think that we should. I tried to have a whole hour on risk factors, and just to let you know what happened to me, I created a mastermind class, and it ended up being twice a week for 90 minutes for 4 weeks. So I don't know how many hours that is.
Yeah. So there you go.
Just to cover, literally just to cover the risk factors surrounding COVID. And I think you probably are the same way. What starts out as an easy project in my head ends up being a very, long.
Well, at least you complete them. They just stay as ideas in my head and don't get any further than that usually.
Listen, the only way I complete anything is because I surround myself with, I'm going to be really specific here, highly capable women. I'm telling you, my wife and our team are all females except for one other person. And I have just found that they are much more organized, at least, than myself. And most of the men that I know. So I give a shout out to.
And I'm not helping that at all, because I'm right in that.
Right. Hey, I always used to say that, well, that's because, genetically, men are programmed to go out. We could do one thing. We could go hunt or gather. And that was our thing that we did. but the women folk would stay back and, prepare the food and take care of the village and take care of the kids and all that. And until recently, I don't know if you saw, there was an article that came out that said, no, it turns out that women were actually hunting and gathering as well.
Yeah, I saw
and I'm like, man,
they're basically just way more badass.
They're superhumans. They're badass, badass superhumans. And we are the weaker and lesser of the two sexes. I'm the first to admit it, And like I said, I try to surround myself with highly capable people, but they just turn out to be the female. Nonetheless, Dr. Chong, people can find you at drdanielchong.com. I highly recommend that everybody checks out his website, but also, if it's okay for me to say it, follow Dr. Chong on social. It's Daniel Chong, and I'll make sure to tag him everywhere that we post this. Follow Dr. Chong. He has a very interesting, unique perspective with the data. Dr. Chong, last words, anything that you would like to leave our listeners with, any bits of practical advice, take home, start this up right away or start this up on Monday type of advice?
Normally I would have something like that, but I think there's something I wanted to get in that's not really advice or whatever, but I think it's important to be said. Because we've talked like multiple times now, we've mentioned this idea of like every death matters and all of that type of thing, and how we're not denying anything that's going on with COVID. And I couldn't agree more. And one of the issues that I've had all along is, because I've come out pretty strongly against the ideas of lockdowns and that type of thing, with some pushback. And my feeling all along has been this general idea that if we were somehow capable of treating COVID in a bubble, where the decisions made around trying to prevent it, treat it, et cetera, did not have any larger impact outside of what's going on with COVID, I would be much more in support of a variety of different things that we're trying to do. But the thing that's been so confusing to me is that it's been really the opposite. The majority of the decisions we've made policy-wise in different states and nationally and globally has had such a massive negative effect on people out there who, in my opinion, would be lucky to just get COVID instead of just having to find food each day or, fight off a variety of other infections because they have no healthcare facilities at all or no clean water or whatever it is. These people don't get mentioned at all. And even in the United States, there's 8 million new cases of poverty since COVID started, last I heard. And a doubling of the amount of hungry people in our country. And I've seen studies from UNICEF, et cetera, predicting literally millions of additional deaths as a direct result of what I would call our response to COVID. So the issue that I've had more than anything is just how it feels like, I think it was, I can't remember who it was that said this, but essentially things like lockdown and that type of thing, those are actions of the privileged. And those are luxurious things that the majority of people, even the average low to middle income person in this country, doesn't have the opportunity to really do. And one time I just posted something that said something along the lines of, if the money that you made today was going to be the money that you use to feed your family tonight, and somebody told you you can't go to work, how would you feel about that? Yep. And that's one of the things that really drives me to try to, again, figure out, are we doing everything that we should be doing? And are we doing things that we shouldn't be doing? And that's what's going to keep me going. And so that's what I wanted to
those are strong words. Lockdowns are the luxury of the privileged is a strong sentiment. I remember that post that you made. And it's very true that collateral damage, manifests itself within the weakest and most vulnerable populations. And I think that we're seeing that. And again, I hope our media shines some light in
Well, I was going to say, most of us aren't seeing that because we don't get told that at all. You have to look yourself. Yeah. And when you do, it's staggering. Right.
Sounds to me like your bits of advice is, investigate, spend some time, look a little bit more deeply. And I mean, I say question everything, question us, right? I mean, question our data. Question what we said. I mean, please look into it. I mean, I'm actually, for my listeners, please look into everything that we said and fact check us, because I stand behind everything that was said in this interview. Yeah. And I'm sure that Dr. Chong does too. Dr. Chong, thank you so much for joining us. And it was a privilege. I'd love to have you back on and chat about, your main body of work, in cardiovascular disease. And
feels like we're just getting started.
Feels like we're just getting started. Hey, thank you so much. And I just appreciate you so much. So thank you so much.
You as well. Keep up the good work.
All right. And until next time, stay safe, stay healthy, and stay happy, and have a great and happy new year. Chat with everybody soon.